Prominent eyes are always beautiful. Everyone wants to have a big, prominent, good-looking eyes. But sometimes it may be pathological. Welcome back to ophthalmology for undergraduates and postgraduate beginners. Today we are going to talk about proptosis. What do you mean by proptosis? Proptosis is nothing but forward displacement of the eyeball. I have drawn two pictures here. One is a normal one, other thing is a proptosis. In the first thing, inside the orbit, the eyeball is located and the surface of the cornea is projecting little bit outside. The distance from the lateral orbital margin to the surface of the cornea is somewhere between 10 millimeters and 21 millimeters. That is normal. In the second picture you see the eyeball is displaced outside the normal position in the orbit. You can see that the eyeball is coming out of the orbit. Proptosis means if the surface of the cornea is more than 21 millimeters from the lateral orbital margin. So that is called as proptosis. Sometimes both the eyes may be within this 10 to 21 millimeters. But there may be a difference of more than 2 millimeters between the eyes. One eye, the corneal surface may be 18 millimeters from the lateral orbital margin. Other eye, it may be 14 millimeters from the lateral orbital margin. Both are normal as far as the first criteria is concerned. But the difference between these two eyes or more than 2 millimeters. So, there is a proptosis in the right eye. We can see in these two pictures, because of the displacement of the eyeball forwards, the optic nerve has become straight. Unlike in a normal eye where the optic nerve is somewhat curved. Now, let us see what is a pseudoproptosis. The word itself says it's a false proptosis. Actually, there is no proptosis, but it mimics a proptosis. In which condition we will see this pseudoproptosis. One is axial myopia. Normally, the anteroposterior diameter of the eyeball is 24 millimeters. If the eyeball is elongated anteroposteriorly, as in axial myopia, the eyeball is not displaced outside, but it is protruding outside because of the elongated diameter. So, that is a pseudoproptosis. Second example is congenital glaucoma or ophthalmos, in which the eyeball is very big. Sometimes we call this a cystic eyeball. Because of the big nature of the eyeball, it is projecting or protruding outside the orbit, resembling a proptosis, but it is also a pseudoproptosis. The third cause for pseudoproptosis is retraction of the lid. Normally, the upper eyelid covers 2 millimeters of the cornea, the lower eyelid touches the lower limbus, but when both the lids are retracted, there is a scleral show. It resembles as if there is a proptosis, but this is also pseudoproptosis. This we can see in characters like Ravana, who keeps the eyes open like this. The next example for pseudoproptosis is ENOPHTHALMOS. What is ENOPHTHALMOS? Proptosis is forward displacement of the eyeball. ENOPHTHALMOS is backward displacement of the eyeball. The eye can displaced backward because of any fractures in the orbit, so that the eyeball goes back. Or there may be a orbital pad of fat atrophy, making the eyeball go backwards or displaced backwards. When one eyeball is ENOPHTHALMOS, the other eye may look very prominent and you may think that the other eye there is a proptosis. But actually it is not so. It is only enophthalmos on the opposite side. The fifth cause or fifth example for pseudoproptosis is pseudocornea or anterior staphyloma. Pseudocornea occurs in corneal ulcers which have gone for perforation, artificial or healing cornea is being formed, which is protruding outside in a very big way, so it resembles a proptosis. It is anterior staphyloma. Sometimes in very high myopia, patient may have a posterior staphyloma. Because of the posterior staphyloma, the eyeball may be protruding outside of the orbit. So that can also mimic a pseudoproptosis. Let us see about two more terms today before finishing this session. One is exophthalmos. What is this exophthalmos? Exophthalmos is nothing but a proptosis which is associated with the disease of the thyroid. It may be a hyperthyroidism, it may be a euthyroidism, or it may be a hypothyroidism. But when it is associated with the disease of the thyroid, then that is called as exophthalmos. Usually we talk about Graves' disease, where there is a hyperthyroidism associated with proptosis. That is called as exophthalmos. The second thing is dystopia. What is dystopia? We said proptosis is a forward displacement of the eyeball. But dystopia is not a forward or backward displacement like proptosis or enophthalmos. It is a sideways displacement. It is a sideways displacement. So the eyeball may be shifted like this. Eyeball may be shifted this way. Eyeball may be shifted upwards or downwards. That is called as dystopia. You should not get confused with squinting of the eyes. In squinting of the eyes, the eyeball will be rotated like this, or it will be rotated like this, it will be deviating like this. But in dystopia, the eyeball moves like this, sideways. So that is the difference between squint and dystopia. You should not confuse with that. With this, we will stop today. We will discuss more about proptosis and its causes in the next session. Thank you.